Welcome to the Darcy Wellness Show. My name is Jeff Darcy. I'm an acupuncturist and herbalist at the Darcy Wellness Clinic in Natick. And with me today in the studio is Dr. Judy Dempey-Wolf, psychotherapist, and we're talking about stopping smoking. So I'd like to kick off with our first slide because the figures of Judy on smoking are pretty amazing.
Yeah.
I was surprised to find that 25% of all American adults
Still
are smokers. It's amazing. You think these days it would be less, and that cigarette smoking is still the leading cause of death and illness among Americans. Wow. Every year, roughly 430,000 Americans die from illnesses caused by tobacco use. Just amazing. Just accounting for one fifth of all deaths. So, in your practice, Judy, when you start to work with people, because I know that in psychotherapy you work with addictions in general, but also around helping people stop smoking.
Right.
So you've been doing that for a while. You think the bad news would be enough to make people stop?
People have a lot of misconceptions about quitting smoking, that it's hard, that it's a sacrifice. So I have to start helping people see it differently, because
they have to reframe it.
Yeah, it doesn't have to be hard, and it doesn't have to be a sacrifice.
Right.
In some ways, it's a freedom, and they need to frame it in those terms to make it more accessible.
So if we could have the next slide, the financial costs really as well. That tobacco use costs the nation $100 billion each year in direct medical expenses and lost productivity. And a pack a day, actually, for most people costs $3,000 a year.
You could do a lot with that.
Yeah, in fact, I worked with somebody who was taking his wife to the Caribbean based on his savings on 20 packs a day. And the other interesting figure to me is that smoking costs the health insurance $3,600 more than a non-smoker in say a company situation. So if a company has say 10 smokers, that costs that company $36,000 more each year just based upon absenteeism, presenteeism. All these factors are, health-related factors, time away from work.
Breaks, smoking breaks.
Exactly. Yeah. No, the smoking breaks are actually on top of that. In fact, some companies are getting stricter and stricter. So we'll cover that a little bit later.
Okay.
The other figure the other slide I'd like to show is basically, the misconception that why stop smoking, because almost like the die is already cast and I'm going to die of it or get sick of it anyway. But you can't see this one very well on the TV, but pretty much you can see the lines going down. So on the left, the white line we have going down is basically starting at a 25-year-old non-smoking lung. And then going on the bottom, we see the scale going towards 79. That's in age. And the top blue line is basically never smoked, so that you lose some lung functioning over time. And then we see the other steeper blue line coming down that's heading towards an early death. That's people who have smoked regularly and are susceptible. And these are all kinds of illnesses to susceptibility towards pneumonia, aggravation of heart disease, respiratory failure. But we can see those two yellow lines coming off from the blue line. That we can see if you stopped at 45, you can still extend your life considerably. That's a major difference. And even if you've smoked all your life and you stop at 65, you can still extend your life by about 5 or 6 years.
Yeah.
So although we're going to cover the bad news first here, and we'll get to the good news. Hopefully it'll be a shock therapy. But most people really aren't aware what goes into a cigarette too. And if we could move into our next slide, there's all kinds of nasty stuff going in that has very little to do with what's in the actual plant itself. So we see that there's carbon monoxide. Of course, what's in it. Carbon monoxide is in car exhaust. It's that bad for us.
Right.
Tar from road, that's used in road services. Butane is a lighter fuel. Ammonia is a cleaning product. Methanol is used in rocket fuel. Formaldehyde is used to pickle dead bodies. Cadmium, radon, and cyanide. So the bad news just keeps getting worse if you're a smoker. And there are some, you know, if we go to the next slide, just to get the bad news over quickly here, we can see that both lung cancer and emphysema would be quite rare if people would stop smoking. So compared to a non-smoker, a smoker faces 14 times greater risk of dying from cancer of the lung, throat, and mouth. 4 times greater risk of dying from cancer of the esophagus. 2 times greater risk of dying of a heart attack. And 2 times greater risk of dying of cancer of the bladder. So that's a lot of bad news.
Yeah.
A lot of bad news. So what drives it? I mean, people are pretty much aware these days that, okay, you know, I'm choosing death if I light up a cigarette continuously.
People think that they're the exception often, and they think it's probably not going to happen to them. You know, they're the good statistic.
I guess we all suffer from lack of appreciation of impermanence. That we, you know, the idea that we're going to die becomes an intellectual kind of exercise. But, but that's pretty shocking. And but there is some good news to this too. And I want to just cover this quickly. If we go again to the good news slide, which shows us that within 20 minutes of stopping smoking, of giving up, that your blood pressure and pulse rate and your temperature of your hands and feet all return to normal. Within 12 hours, your blood oxygen levels will have increased to normal and the toxic carbon monoxide levels drop to normal.
Wow.
Within 48 hours, damaged nerve endings have started to regrow. Within 72 hours, your brain and body will test 100% nicotine free. And all but 10% of the remaining nicotine metabolites would have been passed out of your body. Within 10 to 14 days, the body adjusts to the function of nicotine, and more than 3,500 other toxic associated chemicals. Within 2 weeks to 3 months, your risk of having a heart attack has started to decrease. And if we go on to the next one, the next slide also shows within 1 to 9 months, any smoking-related sinus congestion, fatigue, shortness of breath will have significantly dissipated. Within 1 year, your excess risk of coronary heart disease will have dropped to less than 1/2 of a smoker. Within 5 to 15 years, your risk of having a stroke will be reduced to that of a non-smoker. And within 10 years, your risk of future death from lung cancer will have been cut in 1/2. So that's pretty significant.
That's really good news.
Pretty significant. So most people are aware of the bad news. They're, you know, not so aware of how quickly the body can turn things around.
Right, right.
So emotionally, as a psychologist at the Darcy Wellness Center, what do you find that people get stuck on in trying to give up smoking?
People are afraid of withdrawal.
Yeah.
And what I tell them, which is very true, is going through a night of sleep without a cigarette, you've already withdrawn a good 3/4 of the way.
Yeah.
So the physical withdrawal is not huge, and we all know when we're changing a habit, the 3-day rule, that it takes at least 3 days for the physical withdrawal to go through its cycle.
Yeah.
Then it's the mental, the emotional.
That's the tough part.
Yeah.
Because as an acupuncturist, I've worked, over the last 25 years, helping people to stop smoking. We run corporate programs, and so we found that around the 21-day mark, people are over the physiological part of the withdrawal process. Then it's down to, can they hold the emotional side together?
Right, right. And very often I talk with people about a different framework around quitting. Instead of seeing it as sacrifice or they're depriving themselves of something, to start looking at it as freedom.
Yeah.
Freedom from having to...
being a slave.
Light up. Yeah. Very much so. And then the other piece of it is looking at the craving as just a way that little monster, that little addictive monster is saying, have another, have another.
Right.
But having another feeds the craving.
Yeah.
It doesn't take it away. It makes it worse.
So the more you react, the more you want to react.
Right.
Yeah.
So the trick is to say, oh, there's the little monster again. Well, I'm just going to sit with it, and the craving will dissipate. Yeah. And it does.
So how do you get people to kind of generate a movement towards actually stopping? You know, the idea of how to get motivated. For instance, I had when I had this patient come in one time. He was an 86-year-old guy who had been smoking since he was 11. 40 to 50 cigarettes every single day since 11. So he had a good 70-odd years of smoking under his belt.
Plenty.
And I said to him, what on earth brought you in? You're 86.
Yeah.
And what it was for him was his dog died of secondhand smoke, cancer caused by secondhand smoke, lung cancer. And he was so mortified that he said, in memory of his dog, he was going to stop. He came in, he had 3 acupuncture treatments, and I remember calling him back because he hadn't come in for a month after his first 3, and I called him back and I said, what's going on? Have you started smoking? And he said, no problem at all.
Yeah.
No physical withdrawal after 70 years of smoking every day.
But it was mental.
Yeah.
He was committed. He had a plan.
Yeah.
And he just stuck with it.
So, you know, you do corporate wellness programs around this. So, so for instance, you recently went in and ran a group.
Right.
So that group was the group would meet once a week for 3 weeks.
Right, right.
How would you start them off in that group?
Well, I have a little booklet that I use that has little paragraphs for each day for them to read and think about. I purposely don't start off saying you have to quit right now. Yeah. People have to come to a place where they're ready to be free of cigarettes, so that in the beginning, what I like them to do is really taste it, really, really have an experience of what they're smoking.
So spend time consciously being with
the addiction. Yeah. Because people will say it tastes good. It really doesn't. Yeah. All those chemicals, they can't taste good.
That's right.
So part of it is the awareness, raising the awareness of what is it about this cigarette that you like? Yeah. What does it do? It doesn't relieve stress, really. It doesn't fill your hunger because it's not food. Yeah. You know, people will have many reasons why they smoke, and we'll talk about those.
So you start to try to identify what the underlying hunger is, what psychological, emotional reason they're doing it.
Absolutely.
Filling a void.
Filling a void.
So I can understand that in an individual process with somebody working one-on-one, you can be targeted and find that individual need. But say in a group, how does that work? You just make them more aware of what that can be, some sort of self-reflection?
Self-reflection, also talking with one another. Yeah. You know, if one person says, well, I don't think it tastes that good, then the other person might think, maybe that's true. You know, they might help each other.
Especially in a work environment, too, because so much of it will revolve around the social element. You know, there was one company we ran a program in where they would leave their workstation together, have a smoke, a chat, you know, about life in general, about work in general, come back to the workplace a good 15 minutes later.
Sure.
You know, and when one gave up, the other one was brought into the process too, you know, and had nobody to go out, didn't want to go out by himself, and also stop. So that kind of social element to smoking is quite good.
And it would be nice if workplaces had a substitute. Yeah. Where people could have 10-minute social breaks around the cooler or the coffee pot without.
Well, one of the, you know, one of my pet theories is that, you know, that smoking is actually a gross tracer of the breath. So that you know, taking a break, walking outside, you know, having a break, tracing the breath. You know, normally anxious states are much more associated with shallow breathing, and that you take a few minutes just to breathe in past that shallow breath and into the belly, that you create a small version of the relaxation response, and that creates, you know, a natural endorphin flow. So actually, it's a gross relaxation response that you use the smoke to trace the breath. So just leaving the bad stuff aside take that 10-minute break,
Yeah.
go outside, take 10 belly breaths into the belly. So you're tracing the breath. It's becoming deeper. You're pulling yourself out of the shallow breath. And people have found that to be quite effective too.
Yeah.
So if we could go to our next slide and look at the acupuncture, which is my love. So one of often a two-pronged approach is Judith's approach with psychotherapy, but mine is also with acupuncture. And that acupuncture has been practiced for centuries for all kinds of addictions and found to help people. In fact, in Hong Kong, a particular protocol became very popular to help people stop smoking opium. And so they found that they were able to get over withdrawal much quicker. And if we go quickly to our next slide, that acupuncture really helps with smoking withdrawal, and that studies demonstrate that smokers who are given acupuncture treatments have less desire to smoke, and their smoking actually decreases after the treatment of acupuncture. And one study that I'm familiar with showed that 40% increase in people who used acupuncture to stop smoking over those who didn't. So it's a great tool to help people over the withdrawal symptoms. And we go quickly to the next slide. So acupuncture and herbal medicine are a natural way to help calm the emotions and support the lung and immune system, which basically helps with the detoxifying. So coming back to the two-pronged approach, the idea that acupuncture is so helpful to help people over the physical withdrawal symptoms, the stimulation of natural endorphins. And it's very helpful also for heroin and many other, cocaine and many other powerful addictions. But then once you're over that hump, you're over the physical need, but then there's still that emotional hunger in some people.
Right.
How do you get to grips with them?
Well, for people to explore what smoking has done for them, they can then, without looking at smoking as the enemy necessarily, they can then say, well, what are some other ways in which I can have this, whether it's comfort or physical exercise.
So replacing one ritual, one negative ritual with a positive ritual.
Certainly physical exercise can be helpful because it does that deep breathing again, which helps detoxify quicker, bring the oxygen in, and gives them a real positive, healthy habit to replace the unhealthy habit.
So some of the, if we go to our next slide, some of the common reasons that I come across in practice, and I'm sure you come across a number of them as well, is most often people will say, well, I really want to be around for my children and my grandchildren. They know they're heading towards the bad news, and they want to do something about it. And they also want to protect their wife or their loved ones. And then there's the idea of the secondhand toxins that are extremely powerful. And not just if you're in the immediate vicinity, but even long after, the secondhand smoke toxins can linger into carpets and into curtains. And the other major reason I come across is people want to save their hard-earned money, like the guy who stopped smoking and then treated his wife with the $3,000 vacation to the Caribbean based on the stopping. So any other reasons that you find common in your practice?
Some people get tired of living in denial, of hearing all the bad news and not
because it is
doing something.
Every time you grab a cigarette, your unconscious mind knows it's
bad.
Disease and death.
And now cigarette packs have all those warnings on them. So, people, I think, live in kind of a dissonance with themselves, and they don't like that feeling. So.
How do you help them? How do you, first of all, bring it up to consciousness that they are choosing death, they are choosing illness, they are choosing an earlier death to be away from their spouse, away from their families. Every time, unconsciously, they know that. And that takes a lot of energy to keep down and repress.
It does. So, the awareness of each cigarette and how it tastes and how it feels is really important, because when they get that it really, they're fooling themselves that it tastes good.
Yeah.
When they really taste it and they realize they don't want the whole thing, that's a big step in the right direction.
Right.
Because they're realizing it's
just
not all that
being
great.
controlled by rote, by habit.
Right.
Yeah.
Right.
Yeah.
And by that stick.
Yeah. Yeah.
So to build a new way of thinking about it and feeling about it,
so
without it being a big deal to quit.
I understand how you work in the corporate environment. You have these 3 sessions to help make people aware, and you use the booklet and you guide them through. But how do you work in your own practice? Is there any kind of once a week for a while that you've worked out over time?
A good framework is a month long, once a week, with reading the booklet, making their own decision about when they want to quit.
So they work once a week. They come in 1-hour session with you once a week for 4 weeks.
Yep.
You give them the book and written materials and set homework, basically.
Homework,
for them. Yeah.
absolutely.
Yeah.
And they become more aware, and they build a new mental framework.
Right.
And suddenly it makes no sense to keep smoking.
Yeah.
Basically.
And, and again, for the withdrawal, if we go to our next slide, the withdrawal process can be quite severe for some people. Some people can dodge it, but it is a very physiological, powerful process. I think it's even more powerful than heroin addiction in some physiological ways. But so the protocol that I've developed as an acupuncturist at the Darcy Wellness Clinic is 5 acupuncture treatments over 21 days. So that looks like 2 a week for the first couple of weeks, and then 1 at the end. Then there are herbal supplements that are extremely helpful as well that we have them take every day. And then 20 minutes of a guided relaxation technique. This idea that they try to establish positive rituals, as well as the 10 belly breaths where they step outside, keep the relaxation ritual of the break, but let go of the grosser negative of the smoking.
Right.
And then to, think about getting a massage. Some people get very tight and tense when they approach letting go of very deep comfort habits.
Right. If they're saving money on cigarettes, they could
right.
allow themselves a massage.
Yoga and Tai Chi, exercise, relaxation, and, just for the couple of weeks, avoid stressful situations. I once had a patient who came in to see me, and she did very well for the first couple of weeks. And then there was this big stressful crisis, and everybody had to drive off to New York suddenly in her workplace. And she found herself in a car with 3 other smokers on a 4-hour drive to New York in stressful circumstances. She was smoking within the first hour.
Of course.
Yeah, and that really tripped her up. And I see this a lot, that people unconsciously trip themselves up within the first month. Why do you think? What's kind of fueling some of that?
I think they fall into old patterns where they used to smoke.
Yeah.
And you're right, to avoid stressful situations if possible, to also avoid friends who smoke for a little while. Yeah. Not always, but just until you get your own resolve.
Get out of the negative
away.
rituals.
Yeah. Because those are tricky.
Because people, do trip themselves up a lot. And I've seen it where they'll go out with a group of friends to dinner, and then they'll go out for drinks afterwards, and they know that these friends are smokers.
Yeah.
She knew that she was setting the date with these friends when she was in the middle of the stop smoking program, and yet she still went ahead and did it. And of course, the old patterns completely
I think
took
people
over.
Don't understand the power of those situations.
Yeah.
So it's good to set those boundaries for
It's like a Pavlovian response.
Absolutely.
The bell rings and
light up.
That's right. You're out with your pals and you've got a drink in your hand, and before you know where you are, you've got a cigarette right there.
Yeah. I think from what I've read research-wise, too, there's a chemical interaction with alcohol and cigarettes where it increases that
it's a big trigger.
Addiction.
Yeah. So if we could go to our next slide, one of the things I tell right from the get-go is clean your house.
That's a good
I
idea.
had somebody sabotage themselves. They had, within the first couple of days, had dropped something on the floor of their car. They leaned over, picked it up, saw one cigarette underneath the car, and they said that that cigarette was out from underneath the seat, in their mouth, and lit quicker than you could say anything. Stop smoking. And they just completely sabotage.
Yeah.
So the idea, throw away all the ashtrays, the lighters, really commit. Wash the clothes, get the smell of the smoke out,
Yeah.
clean the carpets, draperies, use air fresheners, help to rid your home of that kind of familiar scent that
And
sometimes...
how freeing that would be.
That's right. It's
How
a
freeing.
breath of fresh air
Yeah,
you're opening
yeah,
up,
yeah.
bringing in fresh air into your life. So the idea of cleaning out, really letting your unconscious get it. Oftentimes I say to patients that they know when they are a non-smoker,
Yes.
because they've had a dream. And in the dream, they've been offered a cigarette and they've refused the cigarette in the dream. That's at the time they know they really are a non-smoker.
Yeah.
Up to that point, I tell them they've got to be on full alert.
Yeah.
You know, because I think it takes a while for the unconscious. You have an habitual pattern for 20-odd years, and suddenly they stop. The unconscious is still going off in that groove, and it hasn't had the command from the consciousness. So if you have that dream that you've actually stopped, it's like the unconscious is on board with you, and it's no longer trying to sabotage, you know, and trip you up by silly mistakes in the present.
I think there's a lot to be said for the new identity of being a non-smoker.
Right.
And what that means to somebody and how that fits for them to begin to settle into those shoes of being a non-smoker and feel free.
So that must bring you know, not just fresh air literally into one's life, but also on a, you know, emotional mind level. They are now positively not reinforcing those death wishes every time they're smoking. They're freeing themselves of being a slave to the habit.
Absolutely.
20 times a day the bell goes and the response is automatic.
Right, and it's just that little stick that does it. And to keep remembering that if the craving comes up, that to reduce it, you just sit with it. To increase it, you pick up the cigarette.
So if you can sit with it, soften around, feel where that sensation is in the body.
Let it ebb and flow.
Soften with it, not react to it. And then the more you do not react to it, the easier it gets.
Absolutely.
Yeah. Absolutely. And if you're coming out of, I'm doing something good for myself instead of, this is the worst thing. What the hell am I doing this for?
Absolutely.
Yeah.
Absolutely.
If we could go to another one of our slides quickly. Where do habits come from? You know, the idea of what you were saying is to examine your emotions. It is very, you know, it is very common to have a relapse, but there's a lot that you can do to prevent those relapses. You're examining the emotions, the circumstances that lead to and learn from them instead of just dropping them down. So if we can whip through our last couple of slides quickly, go on to exercises, get moving. You know, actually the relaxation technique is a very important one. 20 minutes a day over a 5-week period can really get control of the relaxation process. So 20 minutes of progressive relaxation will slow the heart rate, reduce blood pressure, it will slow the breathing rate, reduce the need for oxygen, increase blood flow to the major muscles, and lessen tension, just with, all proven physiologically, just with 20 minutes of relaxation, which we always suggest to go along with the stop smoking. Exercise is a huge one.
Yes.
And on to our next one, eating fruits and vegetables. A Duke University study shows that fresh fruits and vegetables make cigarettes taste terrible. And this is helping, it gives us a help towards the cravings. And on to our concluding slide, do it for your health. So there's more than just a monetary reward to consider, that smoking cessation has immediate health benefits. The good stuff starts to happen to the body and mind immediately that you stop reacting blindly to those compulsive need to pick up a cigarette. And is there anything that you'd like to add just before we conclude?
Anybody can do it.
Yeah.
I mean, most people who've tried to quit a few times get kind of hopeless about it.
Right.
But people can do it.
Just to apply more technology, like the acupuncture, the herbs, the psychotherapy, and really focus in on it.
Yeah. It's not impossible.
No, it's not impossible, and you can save yourself an enormous amount of suffering and those around you just by taking that first step. So thank you very much, Judy Dempey-Wolf, psychologist at the Darcy Wellness Clinic, and from myself, Jeff Darcy, acupuncturist and herbalist. I want to thank you very much for listening to the Darcy Wellness Show today. Thank you very much.